What is the function of a foramen in a skull bone? Imagine a busy highway with roads leading in and out, connecting different parts of the city. The skull has similar openings called foramina that let important structures pass through. These tiny holes are essential for keeping the head connected to the rest of the body. They are part of the axial skeleton, which includes the skull, spine, and rib cage, providing support and protection for vital organs like the brain. Foramina serve as passageways for nerves, blood vessels, and sometimes veins. Think of nerves as messengers that carry signals from the brain to muscles and sensory organs. These nerves need a way to exit or enter the skull, and foramina give them that route without compromising the skull's strength. Blood vessels, such as arteries and veins, also use these openings to supply oxygen and nutrients to the brain and remove waste products. Some foramina are quite large, like the foramen magnum in the occipital bone, which is the biggest opening in the skull. It allows the spinal cord to connect to the brain, acting as a critical link for communication between the brain and the rest of the body. Other important foramina include the jugular foramen, which transmits nerves controlling functions like swallowing and speech, along with the main vein draining blood from the brain. The optic foramen in the sphenoid bone is a small opening that allows the optic nerve to pass through, enabling vision. The internal acoustic meatus in the temporal bone is another tiny passage for nerves involved in hearing and facial movement. The hypoglossal canal in the occipital bone carries the nerve that controls tongue movements. In the big picture, foramina are vital features of the skull bones because they let nerves and blood vessels pass through, connecting the brain to other parts of the head and body. Without these openings, communication and blood flow would be impossible, leading to serious problems. In medicine and surgery, understanding where these foramina are located helps doctors avoid damaging important nerves or vessels during procedures. If a foramen gets blocked or injured, it can cause issues like facial paralysis, loss of sensation, or vision problems. So, the main role of a foramen in a skull bone is to act as a protected passageway for nerves and blood vessels. This allows the brain to stay protected inside the skull while still communicating with muscles, sensory organs, and the circulatory system. These tiny openings are what keep the head connected and functioning smoothly within the entire human body.